Preparing for your first OB-GYN visit can feel intimidating, especially if you're not quite sure what to expect. But taking this important step is a powerful act of self-care, one that sets the stage for a lifetime of health and well-being. Whether you're going in for a routine checkup, your first ever pap smear, or simply to ask questions about your body, being prepared will help you make the most of your appointment. Here's everything you need to know to get ready for your first OB-GYN visit. First, let's talk about why this visit matters. An OB-GYN, short for obstetrician gynecologist, is a doctor who specializes in women's reproductive health. They're trained to guide you through everything from puberty and menstruation to fertility, pregnancy, and menopause. Even if you aren't sexually active or aren't experiencing any specific symptoms, seeing an OB-GYN is essential for preventive care. Early appointments help you establish a baseline for your health, catch any concerns early, and build a relationship with a doctor who can support you throughout your life. Now, let's move on to practical steps you can take before your appointment. Start by gathering information about your medical history. This includes your own health background, such as any previous illnesses, surgeries, or hospitalizations, as well as any family history of conditions like breast cancer, ovarian cancer, or endometriosis. If you're taking any medications or supplements, jot those down as well. Knowing your last menstrual period, the first day of your most recent period, is especially helpful, so try to keep track of your cycle in the weeks leading up to your visit. Next, think about your questions and concerns. It's completely normal to feel nervous or shy, but remember, your OB-GYN is there to help you. Write down anything you're curious or worried about, whether it's irregular periods, painful cramps, contraception options, sexual health, or even concerns about your body's development. No question is too small or embarrassing. Your doctor has heard it all before. Before your appointment, check with the office to see if there are any special instructions. For example, some providers prefer that you don't schedule your visit during your period, while others are happy to see you at any time. If you're going for a pap smear or STI screening, you may be asked to avoid vaginal creams, douching, or having sex for 24 to 48 hours beforehand, as these can affect test results. If you're unsure about anything, don't hesitate to call the office and ask. On the day of your appointment, wear comfortable clothing that's easy to remove, since you'll likely be asked to change into a gown for the exam. Bring your health insurance card, a photo ID, and a list of any medications you're taking. If you have any paperwork to fill out, arrive a little early so you have plenty of time. As you check in, you'll probably be asked to provide some basic information, such as your age, contact details, and emergency contacts. You may also be asked about your menstrual cycle, sexual activity, and any symptoms you're experiencing. Answer as honestly as you can. This information helps your doctor provide the best care possible. When it's time for your visit, you'll be brought to an exam room where you may be asked to provide a urine sample. This is a routine part of many gynecological visits and can help screen for infections or pregnancy. Once you're in the exam room, you'll be given privacy to change into a gown, usually leaving your underwear off and covering yourself with a sheet or drape. Your OB-GYN will begin by talking with you about your medical history and any concerns you have. This is your opportunity to ask questions and share anything that's on your mind. Don't be shy. Your doctor is there to listen, not judge. The physical exam typically includes checking your vital signs, such as blood pressure, pulse, and sometimes your weight. If this is your first visit and you're not sexually active, your doctor may simply do an external examination of your vulva to check for any abnormalities. If you are sexually active, or if you're due for a pap smear, your doctor may perform a pelvic exam. A pelvic exam is a routine procedure that allows your doctor to check the health of your reproductive organs. It usually involves 3 parts: an external exam, a speculum exam, and a bimanual exam. For the speculum exam, your doctor will gently insert a small instrument called a speculum into your vagina to hold it open and view your cervix. If you're due for a pap smear, a small sample of cells will be collected from your cervix using a soft brush. You might feel some pressure, but it shouldn't be painful. The bimanual exam involves your doctor inserting 1 or 2 gloved fingers into your vagina, while pressing on your abdomen with the other hand. This helps them check the size and position of your uteruses and ovaries. Throughout the exam, your doctor will explain what they're doing and check in with you to make sure you're comfortable. If at any point you feel anxious or want them to stop, just say so. They'll always respect your wishes. If you're getting tested for sexually transmitted infections, STIs, your doctor may take additional samples or recommend a blood test. It's important to be honest about your sexual activity so your doctor can recommend the right tests for you. STI testing is routine and nothing to be embarrassed about. In fact, regular screening is a sign of responsible self-care. Once the physical exam is complete, you'll have a chance to get dressed and talk with your doctor about next steps. They'll go over any findings, discuss test results if available, and recommend any follow-up care. If you need vaccinations, such as the HPV vaccine, they may be offered at this time. Be sure to ask about anything you don't understand or want more information about. Your doctor is there to help you make informed decisions about your health. After your visit, you might feel a sense of relief, accomplishment, or even empowerment. It can take courage to prioritize your health and talk openly about sensitive topics, but you've taken an important step. If your doctor ordered any lab tests, you'll be contacted with results, usually within a week or two. Make sure you know how to reach the office if you have questions or if you don't hear back. Going forward, your OB-GYN can be a valuable partner in your health journey. Routine visits, typically once a year, help catch problems early, keep you up to date on screenings, and provide a safe space to discuss concerns as they arise. If you ever experience new symptoms, such as unusual bleeding, pelvic pain, or changes in your periods, don't wait until your next scheduled visit. Reach out to your doctor right away. Remember, your comfort and well-being are paramount. If you ever feel uncomfortable with your doctor, or if your concerns aren't being taken seriously, it's okay to seek care elsewhere. You deserve a provider who listens, respects you, and makes you feel safe. To make future appointments easier, consider keeping a health journal. Track your periods, note any symptoms, and jot down questions as they come up. This will make it easier to communicate with your doctor and spot patterns over time. You might also want to bring a trusted friend or family member for support, especially if you're feeling nervous. In summary, preparing for your first OB-GYN visit is about more than just showing up. It's about taking charge of your health. Gather your medical history, write down your questions, follow any pre-visit instructions, and remember that your doctor is there to help you, not judge you. The experience may feel a little awkward at first, but with each visit, you'll gain confidence and knowledge about your body. By making your reproductive health a priority now, you're setting yourself up for a lifetime of well-being, and that's something to be proud of.